All right. Welcome back, everyone, to Mic Check.
Two.
We have Aja, Rachel, and myself, Sean. And today, for the episode, we are going to be joined by the lovely Rolinda. How are you doing today?
I'm great. Thank you. I'm so
problem.
excited to be here.
Thank you so much for coming. Rolinda, tell us a little bit about yourself, such as how long you've been with the company, what got you started here, and what exactly do you do?
So I arrived at St. Hope in 2016. I am currently the assistant director of social work and also one of the behavioral health therapists. And the way I came to St. Hope is our previous director of social work, Priscilla, who was also my colleague in graduate school. I called her up when I finally took my licensing exam, and she's like, "Oh, wait, hey, come over here. Come on, St. Hope." And I ended up interviewing for the job, and I've been here ever since.
Well, we are so glad to have you.
Yes, welcome. So today we have a heavy but very important topic. We're going to be talking about suicide prevention. So let's just go ahead and dive into it.
So just a few stats. On average, there are about 130 suicides per day, and 93 of adults surveyed in the U.S. think suicide can be prevented. The source of this was the Centers of Disease Control and Prevention from the Fatal Injury Report for 2020.
So would you agree with that statistic about the prevention, more importantly?
Absolutely. I do believe that suicide is preventable, but we need to have a lot more sources in place. We are doing a marvelous job in moving toward making mental health a bigger picture, a part of the conversation. We now just released the 988 suicide line, which is a new source for anybody who may be contemplating or need crisis counseling, but we still have a far way to go when it comes to suicide. And so to answer your question, yes, it is. Mental health has definitely need to be a part of the forefront. We have to erase a lot of the stigma and discrimination among our communities and also make healthcare, especially mental health care, more accessible.
That was a good point. You did mention one of the resources, or is there other resources available?
We have a very amongst the Houston area specifically I can speak on. There's the Harris Center, which is a big place where you can go and you can get evaluated based on your sliding fee, and you can get all kind of crisis counseling as well as other services, medication. You have St. Hope, which is now a federally qualified health center that also offers psychiatry on a sliding fee scale as well as behavioral health, and it is affordable. That's important. It's affordable. Equity is a big thing, so being able to afford in mental health care is important. You also have different other places that you can go that are also now, like Bentob has a psychiatric center that you can go when you don't have insurance, because although we are in the great state of Texas, we still have one of the biggest health disparities, and mental health falls under that umbrella as far as accessing care.
What are some of the biggest misconceptions in regards to suicide?
There are more than a few. Some people think that it's an attention-seeking behavior, that people who say, I want to hurt myself are doing it to seek attention. There are also a lot of misconceptions that a person who actually commits suicide actually had everything, or, they have the conception that because they look a certain way or they present a certain way that they may not have those struggles, or they don't understand why they did it because they had this or they had that. They associate mental health with material wealth and gain. So that's a lot of misconceptions too, that if you have certain acclamations that you don't have to deal with mental health. And what we find is that a lot of people who do have those acclamations struggle immensely with mental health, and they struggle with it alone. A lot of times silently. They can't tell the public because they're always in the public eye. So they can't tell the public eye that they're experiencing depression or they're having suicidal thoughts, or, they don't have time to sit in the bed all day. They need to. They still have to function. And then the more they have to function, the more that mental health declines.
And that's a good point. When you said that people have these typical misconceptions that everybody's happy. I know a lot of times, like on social media, we like to portray only the best parts of us. Like, I know even like my Instagram, I only would portray me riding roller coasters or me DJing in a booth, but y'all will never see the struggles behind it, because like being a business owner is really tough. And so behind closed, it may look all glamorous and stuff to y'all, but behind closed door, when nobody's looking, I am by myself, ready to break down and just fall over, because sometimes it can be tough, but nobody will know because I don't tell them. And I know a lot of misconception is People think that everyone's going to be okay, like you said, but behind closed doors, you don't know unless you ask people or you say, hey, let me check up on my friend and just see how they're doing.
I think that's a really good point, not to cut you off, Orlando, to check on your strong friend. Because everybody, like, you look like you have it all together, but it's important to check on your strong friends or, because they need help too.
Right. And unlike physical, ailments, mental health ailments, you can't see. You can't see a lot of mental health ailments or people will not present them, but you can tell. Now, let me take it back. You can't see them as far as on the body, but when you see people that you may see always present, now withdrawn, or you may notice that they don't show up in places that they normally will show up at, or their behavior may be different, or some sign that they just may not be themselves, it's important to check on them and do a check-in and ask, hey, are you okay? I noticed that you're not present like you normally are, or I noticed that your behavior's kind of changed. What's going on? Sometimes it's important to open up the lines of communication because some people automatically don't feel comfortable with just opening up to anybody. But if someone presents to them that they care, that's where the prevention comes in, that someone has intervened and said, hey, I notice you. I see you're hurting. What can I do to help you?
And that's a good point. I know you mentioned just speaking to somebody to feel like they care and things of that nature. So does it start with therapy, basically? Is that a good point to start with if you're feeling, I guess, these thoughts or emotions?
It doesn't even have to start with therapy. It can just start with a friend checking in on you, and then a friend encouraging and saying, hey, you may want to get some help. You may want to try therapy. There's a lot of stigma around in different communities what therapy looks like, what it really is, or just getting psychiatric help, because a lot of people think that if I tell somebody that I'm feeling suicidal that they're going to call 911, and the next thing I know I'm going to be in a room in a straitjacket, which is, again, a common misconception that we have that that's where it's going to go. Now, if it's a safety issue, of course, then we may need some psychiatric intervention, but normally it can start with a conversation and just referring, saying, hey, let me give you a couple of places that you can go. You probably need to call this crisis hotline. Here's a couple of things I can do. Do you need me to take you somewhere? Do you want me to go with you? Mm-hmm. Make an appointment. Here's St. Hope, or here's the Harris Center, or other agencies that help with mental health.
So because I know you're a therapist, and I know you see a lot of people during the day, and everybody comes from different issues. What kind of questions would you ask in a typical session if you were personally worried about their mental health, or if they thought they may have any kind of suicidal thoughts? What do you do to kind of screen for that?
So we open up the sessions with a PHQ-9 and a GAD-7, which is actually typical of all medical appointments as well. Mm-hmm. So if they typically score a little higher in some of those direct questions, it then puts up a red flag that they may be experiencing mild to moderate or major depression. So that opens up the line. And then there's a couple of specific questions on there. Have you found yourself worrying more than a couple of days, or more than a day or two? Do you find yourself isolating, etc.? Then that may lead to us to want to ask and do a suicide evaluation, meaning have you had any suicide attempts? Have you thought about suicide? And if any of those questions are yes, have you contemplated suicide? Have you thought about what you would do to end your life? Mm-hmm. A lot of people don't like to ask those direct questions because they are fear that somebody's going to withdraw. But those are important questions to ask if someone is actively experiencing, especially major depression, or their mental health is declining. If you had a last attempt, when was the last time you made an attempt? What did you do during that attempt? That way you can assess to see what their normal behavior would be. Like some people are pills, so that's their thing. So you want to make sure that you're cautious of what medications are around them. And you then, if we do know that that person is actively suicidal, we want to create a safety plan to make sure that we get them to the necessary resources as soon as possible. Because then again, going back to what we said earlier about suicide prevention, it's about getting somebody, attaching to the resources and having conversations to know that something is wrong.
And just to put it out there again, so if it does lead to like the more questions related more towards suicide than just the typical mental health awareness, mental health issues, you're not just going to end up calling somebody and say, I think this person needs to be admitted into maybe like a psychiatric ward, but you would actually instead develop some type of a treatment plan that they would go along with. So, because I know a lot of people are probably scared that, okay, yes, I'm going to tell my therapist I'm possibly suicidal. Or next thing you know, they're going to try to lock me up, something like that.
The misconception of it, yeah.
Right. If somebody says, "Hey, I've thought about it. I want to make sure. Have you seen a psychiatrist? Can we get you started on medication? Education around what that looks like, and just make it normal. Like I always tell people, you take medication if your stomach hurt. You take some Pepto. If your head hurts, you take Tylenol. Why is it taboo for people to take medication for their mental health? And just educating people that no, you don't always have to be on an antidepressant for the rest of your life, but for the time being, it will help relieve some of your symptoms so that you can actively engage in further treatments such as therapy to help you along the way and get out of whatever that dark space that you're in.
Okay.
But if it becomes unsafe where they literally are walking around with maybe a weapon or they have access to weapons that they actively have tried to use, then we want to make sure that we get them to safety. But ordinarily, that's not always the case or not always the final thing that people always assume. That's the final straw. Like, I'm just going to go into I'm going to have somebody going to think I'm crazy and I'm going to be in a psychiatric ward for 2 weeks by myself.
Right.
Yeah.
It is a lot of misconception about who you can talk to, even feeling comfortable in your own family, bringing up these emotions that you may be experiencing or thoughts around harming yourself. So any advice just in that aspect of not feeling comfortable or not really feeling like the friend, you have the friend to talk to? You mentioned reaching out to a good friend.
Well, not all people have a support system, but if you have one good support, whoever that may be, then that's the person you should have a conversation with. If not, then you utilize and reach out to crisis counseling lines, because that's someone who don't have a past history of you, and they can definitely meet you where you are without having any preconceived notions, because that's what people are fear of. Earlier, I heard the conversation about people being afraid to talk to their family because, of course, we know our family unit can either be the most supportive or they can be the most hurtful people in our lives. Unfortunately, that's the reality of it. And a lot of times people are afraid to go to their family because their family will not take their cry out for help lightly, or they'll say, hey, they always do that every time. But realistically, there may be some trauma in that family or some drama or some past history. So we always, acknowledge or encourage people to find that one medium or that person in their life that they can feel safe with. And if not, seek outside therapy if it's available. Find a therapist or call a crisis hotline, because usually crisis counselors, they don't have a preconceived notion about you. They don't have any historical information. They're meeting you just where you're at in that moment. So anything you say is your story, and that's what it is. And that's the same thing we do in therapy. Wherever you come to us in therapy, we don't have a history of you. What you tell us is what we go off of,
right,
and what we do. But we just try to encourage people to find that safe person or a place where they feel comfortable.
I wanted to ask you something that you had touched on when you said find a friend or someone special. Because I know I won't say everyone, because not everyone has someone they can talk to, but let's say if a person did have someone they talk to. So looking at that person's perspective, let's say they ask that person about their mental health, and the friend says, I have these thoughts, I have these issues. How would you encourage or want to coach the person listening to this? How should they respond? Because I'm pretty sure from a friend's perspective, if someone were to come to me and say, Sean, I have these life-changing thoughts of possibly changing the way or looking at my life differently, and I'll be like, well, what do you mean? And they open up to me and say, there's been times I've had thoughts of possibly hurting myself. How would you encourage the person hearing that?
Receiving that message, yeah.
Yeah, how would you?
I would definitely say don't be afraid to ask the questions. Direct, open-ended questions. Don't be afraid to say, have you tried hurting yourself? How often do you think about hurting yourself? What is causing your thoughts about hurting yourself? What can I do to be present for you? What can I do to, provide that safe space for you? And not be afraid to use the word, use the word suicide. I mean, a lot of times we are afraid to, it's like such a word, like we want to stray away from suicide.
That taboo word.
Yeah, but again, we can't be afraid so many times, because that one conversation can be life-changing from them ending their life to continue in their life. So we have to get in the meat of it and not be afraid to ask those direct questions. Try to avoid the yes and no questions, because you want to open up dialogue and give them a space to express themselves. For that moment, they just may need someone to talk to. And because you asked those direct questions, you made it a part of the conversation, and you brought into fruition that they can now express how they're feeling and tell you what's going on if they feel comfortable.
Okay. Yeah, it was a little deep, because I know there's been times people do get that that comes across your table, and some people don't know how to handle that. They'll be like, "Oh, child, you just need to go talk to somebody." But sometimes that's not necessarily the case, because that particular moment could be the moment that's life or death. Because after you leave that person, you don't know what they may do when they get in their car and they go home. So that dialogue, that it's really needed, because it could possibly prevent something tragic from happening in the future.
Absolutely. And I don't mean to interrupt and bring this up, but sometimes another opposite end of that is that some people who decide to make that transition on their own don't actually talk about it. It kind of just happens. And I know we had a couple of cases in the news where we've seen prominent people. I remember Southern University, she wrote a long thing on Instagram and said, "Hey, I can't do it anymore." And then I saw like comments like, "Hey, you can reach out to help." But it was literally the moment she was getting ready to, make her transition. A lot of times people don't know. And that's why I say it's important to, hey, have conversations. If you see behavior being different, kind of open up, say, "Hey, I see you, a little different. Are you okay?" That one question, "Are you okay?" can kind of change the dynamic of a person, contemplation from actually the prevention. Then we see the young Miss America, and that's kind of just going all the way back to Sean and social media, how we have to be very careful, because when we put people on platforms, when we put people in spaces where they are a figure to us or they are a person of importance, we tend to minimize. And we even do that in our personal lives, like with our bosses or people who we look up to or people who are in higher positions than us. We tend to kind of like think that maybe they're okay. Well, she's always happy. People often suffer silently, especially when it comes to mental health and when it comes to suicide. And that's when, a lot of people are so shocked. It's such a shocking moment that person chose to make a transition. We go back to the girl, Miss America. I think she was Miss America.
Right, yeah.
Yeah, and she was an attorney, and, she was very prominent. The next thing we know, one day she just decided that it was the end. Some people leave notes, some people leave no note. But again, like I said, it's one of those things we have to be more open about it. We have to be more direct with it. We have to get more comfortable with getting in there, asking questions, and paying attention to the dynamic of people. If you haven't seen a friend that always go out with you and all of a sudden they're not there, go check on them. Hey, why are you not with us? What's going on?
So to tie back into when you said that people on social media, on higher platforms, they're more in the public eye, do you think that people on those platforms are at a greater risk of suicide just because we don't know what their mental health status is, or are they on the same level? I would think that they would be on the same level as the average person, but because they're on such a high pedestal,
they just hide it better, maybe.
Yeah. What do you think
So
from
there's
your perspective?
there's a couple of different dynamics to this question. One, no, they're not at any greater risk than anyone else. Anybody who experiences a mental health crisis at any point is at risk for suicide. Right now, statistics say that men about the age about 45 to 54 is at the greatest risk, and the highest number of suicides committed and completed are men over the age of 85, actually. So saying that, it doesn't have a lot of times to do with prominence, but the reason why I refer to people is because we often tend to think that they're okay and we idolize their positions. So when we idolize their positions, we look up to what they have or what they do, and we equate ourselves to that, wanting to desire or achieve what that is, which actually, on the flip side, causes more thoughts of depression, because then they feel like they're having to achieve an unrealistic dream that they've seen or behind someone who's influenced them in the social media culture. But they are often looked over, I'll say, because, again, they have everything. You're happy. And that's the kind of world we live in. If you have everything, you're happy.
Or from what we present,
happy. Yeah, happiness is always equated to material things in our society that we live in now, which is absolutely not true. We find people that have more stuff is actually a lot unhappier because that's what they've attached to. And so finding self or self-discovery or knowing how to deal with themselves when they do have these challenges becomes overwhelming, and then it does lead to possible transitions or thoughts of transitioning using their own methods. Mm-hmm.
Okay, so do you think that with suicide, it's more of like a slow buildup and then something just like, it's like a catalyst that kind of pushes people to actually commit the act of suicide?
So from a clinical perspective, I've seen different situations. So it's unique.
Okay.
Very unique. You have people who kind of let you know, hey, something wrong. I'm about to, I'm at the end. It's happening. I want to, I desire to, I'm thinking about, and it leads up.
Okay.
Then you have those who are very silent.
Okay.
They say absolutely nothing. They withdraw, and then they make the transition. And when you look at people who actually say something, that's one of the issues around mental health, is because we take it as, oh, they always doing that. They always say that. Every time something happens, that's what they say. And they say it because, you know, in my perspective, they're crying out to say, I really don't have really the skills I need and coping skills I need to handle. So the first thing I need is to, you know, first thing I go to is probably to go down that road. We do have this big thing, and I think we talked about it a little bit earlier, where we don't believe them because, you know, if someone breaks up with their boyfriend, they tell their boyfriend, hey, I'm going to kill myself to get them back or something like that. And we don't take it seriously. But deep down inside, nonetheless, people truly may think that, you know, that's the only person they could live with, or they may have such an attachment to that person that, you know, that may be the next thought. So I never say take anybody who ever says, hey, I want to end my life. That is never a statement that's either a joke, or it's not something funny, or it's not something I take lightly. Even if it's meaning solving a minor crisis at that time, one single thing can catapult thoughts. And a thought can become an action. And the action can be completed. So if it's merely a statement, that statement that then becomes a thought, then you contemplate what to do and how to do it. So anytime somebody says that, I never take it lightly. I make sure that I, you know, go down around, ask the necessary questions. Now, will it warrant any, you know, a whole bunch of, like, let me go follow up or send them a call 911? Absolutely not. It just kind of opens the doors for dialogue and trying to connect with them and solve a crisis. You know, when people are in crisis, or when we look at crisis and crisis intervention, the number one thing is that people just can't handle whatever the situations that's going on at the moment, you know, and it just gets overwhelming.
So you did mention coping mechanisms. Is there anything in particular in your line of work when working with people that you saw that was more effective in, like, preventing suicide? I know it's a loaded question because it's like you said, it's not a one person. Ajai always speaks on that. It's not a one solution for everybody. But is there anything that you would want to speak on in regards to coping mechanisms?
Absolutely. So everyone copes with things differently. Mm-hmm. Everyone definitely kind of have their own way of learning to deal with things. What I notice is that when the crisis happens, people sometimes just get stuck in the moment and not knowing what to do, and it's painful. Mm-hmm. And even like an ailment to our body. If, say, for instance, I hurt my arm, I need help at that moment because it hurts. Same thing with something mental or whatever the crisis may be. It hurts at that moment. And sometimes things may hurt us deeper than the other things. So it's important to teach people how to learn how to deal with their things. But a lot of times they need to go to therapy so that they can deal with the trauma, because more than likely people who do have suicidal thoughts or decide to make a plan to transition have experienced in some high level of traumatic experiences in their life. They have unresolved trauma, and we can go down a long road of talking about, you know, the trauma and what trauma does to the brain and what trauma does to the body that, you know, can lead up to that. And then we look at depression or people not understanding why I all of a sudden feel like I can't get out of bed. Why all of a sudden I'm in a dark place. When people have unresolved trauma or adverse childhood experiences that they have not dealt with, things can become a trigger. And one simple situation become a trigger to a whole bunch of feelings that have been embedded, and they've tried to compartmentalize in the back of their head or pretend like I'm over it or it's done, but really it's unresolved trauma, and it just catapults, and then it starts to go into greater things such as depression or other mental health conditions that they may not have, you know, warranted before. And so when people get into therapy, the one thing I always try to teach them is how to cope with life. And I think I did about 2 months ago. I did like a small little talk to a group of women, and the subject was how to cope when you can't. And it takes a lot of strength to find yourself in a dark place and have to do some of the work yourself. But in therapy or in dealing with mental health on our end, we empower people who are in dark places how to then deal with the past feelings or some of the unresolved trauma that they may have that may lead up to these thoughts. So then when these thoughts come, they kind of know what the derivative of it, and they're starting to heal from a lot of stuff. When we talk about suicide, we talk about, I relate suicide to a pain that many people don't understand that you're going through. Suicide is definitely pain. And when people decide to make the transition on their own, it's, I want to get out of pain. And the only way I see myself getting out of pain is to make this transition. And because I don't have the coping skills, or I haven't developed it, or I feel unheard. So it's important that on the flip end, when we are dealing with our partners, our friends, or whatever, that we always give them something to lean on and say, hey, when you are feeling depressed, where's your safe space? Where do you go? Where do you go when you feel like you can clear your head? Teaching people how to divert their mental status, like where they are, or how to, challenge themselves, which could be very hard when they are depressed. But once they start dealing with a lot of things, they start building up what I call a toolbox. And they say, okay, when I have these thoughts, I go to this park. And when I go to the park, I feel free. I feel free as a bird, And I always tell people it's something simple, and it's just a complete example. Like, if you go to the park, if the park is your place, imagine you a bird. And imagine you a bird and you were flying above. What do you see below? And immediately they begin to think about the splendor of the earth that will be below, as if you were in a plane, because everybody looks out the window when they're in a plane to see the splendor of the earth below. And then that began to teach them how to be able to escape in a healthy way for that moment when they're in a dark spot.
And it's so funny you say that, because I have a really interesting obsession with roller coasters. So for people that really know me, I'm like a hardcore enthusiast. Like, I travel the country to ride roller coasters. And so I like that you said that, because I can relate, because when I get onto one and you go up 200-300 feet and you're looking down and then you're just going through there, it's just like a calm comes over my entire body. Like, even for me, I know I deal with my own stressors. So I take these trips to escape from everything, even for a brief moment. And that's kind of like my mental reset, in a sense. So, like, those roller coasters, even to some people, they may think it's crazy. They may think, you're just out there. No, like, that's my way of
Coping.
Yeah, that's my coping mechanism. So I would like to encourage people as well. Like, if you have a coping mechanism, don't let people downplay your coping mechanism, because everyone's mechanism is different.
Yeah, so whatever it may look like, if that's how you cope and it's healthy coping, riding roller coasters is super healthy. Not for me, but for you.
Not everybody's built for that.
No, not
I'm
me.
absolutely afraid of I would not get on a roller coaster. No.
So I do like that you said a healthy escape. I think that's very important, that it's healthy, and like Sean mentioned, that it works for you. Like, roller coasters don't work for me. It's just not happening. But for me, maybe like a walk in the park just to reset my day, or if I'm feeling overwhelmed from just my daily stressors, as Sean mentioned, I like to work out. But, it's a fine line becoming obsessed with things and figuring that out. So is there like a balance, you would say, in your life, just to kind of...
At the moment, for everybody, everything looks so different. So my obsession may be my way of every day making a conscious decision that this is how I'm going to start my day. This is what clears my head. Because I actually at one point in my life, became obsessed with working out. Obviously not now, but at one point in my life, I became obsessed with working out. And that was the way I started. If I didn't start my day, that was my coffee. And it helped me start my day with a clear mind, clear path. I was, already exhausted by the time I got to work. So, I was able to just start my day off that way.
So just backdoor to healthy escapes. What works for you, works for you.
Real quick, I wanted to go back just a little bit to when you were talking about dark spaces. And I wanted to relate it more to our patients here at St. Hope. Because I'll just be real, I've been in the community for well over a decade. I've had people that I've been close to come and go. Some of which is because a lot of their issues is because they found out they were HIV positive. And I know it's a very difficult road for a lot of people to travel down, especially when they're newly diagnosed. And they too can go into a really dark place just because they don't know. They may not know how they received it, or that the person they may have received it from was someone that they truly thought that they cared about or that they loved, and that can trigger them in such a way they won't know how to react. So I just wanted to put it out there that there are wonderful therapists at every location, Sugar Land, Greens Point, Bel Air, that even if you are newly diagnosed, I want to strongly just encourage people, when you see your doctor, truly tell them how you feel mentally, especially newly diagnosed patients, because they don't know, they may not truly understand how they feel mentally. So that's why it's good to have a therapist so you can talk about these triggers and what could possibly lead you from going down a dark road and going to a dark place.
Absolutely. Here at St. Hope, I would say we do a very fine job of connecting our patients to mental health, especially the providers noting when something may be wrong, and continue to either make a referral to psychiatry and psychiatry to behavioral health, or however the map looks. There are a few providers also that have had to go in the room and, give a patient their diagnosis, and they have literally came and got me and say, hey, can you step in the room with me while I have this conversation, to provide that bridge of giving them and to help them through that dark space. During our intake process, we ask, do you want to consider mental health counseling? Have you been seen a therapist before? Are you interested? So it's constantly a part of the conversation here at St. Hope, and that's something I'm so grateful for, that we're constantly utilizing our resources to help our patients. And I have met and come across more than a few patients who have been in crisis and been able to do crisis intervention in that moment, and have trained staff and licensed professionals who can also aid in the crisis intervention process in dealing with newly diagnosed patients. I remember one particular patient, and I gotta say this because I never forget him. He said, man, if I hadn't talked to you that day, I don't know what I would have done when I walked out of here. That has stuck with me, and that's been at least 3 years ago. It literally has stuck with me, knowing how important it is to provide a space and just give them some time to emote, because that's heavy. Knowing that you have a diagnosis is heavy.
So I did just want to say that I really do appreciate you and everybody else that's a part of the team, especially at St. Hope, because I do feel like you guys work together to actually bridge both of them together. Like, you take a patient from one side to the next side. Sometimes people come in and it's just for medical care, and then you can actually leave, speaking to a therapist or speaking to a psychiatrist, and sometimes people don't even realize that they need that. But I just love that you can actually experience that during one appointment. And I think that's very important, because sometimes you don't even think to address or to even look too deeper into those things.
Absolutely.
And so I kind of do want to piggyback and just ask a question, just for better knowledge for myself. We are, as people, we have our thoughts, positive thoughts, negative thoughts. At what point does the negative thoughts that you might have, do you feel like people need to reach out because the thoughts are just there? Like, the frequency of the thoughts are just there. At what point do you think somebody should say, like, hey, maybe I should reach out, or maybe I should talk to someone?
So it's two-faceted. Really, if the thought happens more than once and you say, hey, I might need to go get some help for that so we can help through, because usually the thought is derivative of something that has happened or connected to something that you haven't dealt with. Also, the second thing, if it becomes very overbearing and overwhelming to where it interrupts your daily flow, like you find yourself literally obsessing and thinking repeatedly of this one thought or whatever that thought is all day, every day, and you can't seem to get away from that thought, then it's definitely time to transition to finally work through those thoughts and see where those thoughts are coming from. A lot of times therapy helps people open up and find the root of their thoughts and the root of their pain, because those thoughts are usually coming from a place of pain as well, something that may have hurt you and it's unresolved trauma that you have not dealt with, and the brain is just saying, hey, I'm here, it's here, you got it, it's still here in the brain, and hey, deal with it, and then so it may need you or warrant you to go find some help. The body talks to us, and mental health is the same way as physical health. The body talks to you. The body will tell you when you may, something may be intrusive, and those thoughts may be overwhelming, and other things happen. So you have those physiological effects too, because now you find yourself having these thoughts. Next thing you know, you're in the bed, or you're missing meals, or you're overeating. Now you feel bad because now I'm overeating, or there may be weight gain. So again, like I say, sometimes when it's the beginning of that thought happens one too many times, you probably need to go seek some help, because then again, those thoughts can lead to many other things. And like I said, sometimes suicide just comes with the thought.
So I know Aja just briefly mentioned having the negative thoughts, and you said if it's even just more than once, that they should potentially look out and get some help. So what were the resources available again, if you don't mind sharing?
So we have the new 988 number. Clinicians, psychiatrists, people in the mental health field are excited about this number, because now you have like a 911 emergency number. If you're having crisis, they have crisis counseling available. You do have the suicide crisis hotline available. You do have the Harris Center here in Houston, and other local entities in other counties may have smaller. I just don't identify what, exactly what counties, but definitely here in Houston, you have places like the Harris Center. You also have places, you can also always go to the emergency room, and actually they can't turn you away, and they will actually find you a therapist or a counselor to come do an assessment. So they do have the PRN assessments where someone will assess you, and then if they feel like you may be unsafe, they will then put you in a safety room until they can decide what your next steps are. So I've seen that's a resource as well. Most hospitals, if I say most big hospitals in Houston, have that that area, like a behavioral health area now, which is absolutely amazing. Where people can, get safe, or, be able to be seen. And of course they can't, hospital can't turn you away. They can only refer. And They have a clinician, they have a MAT team. Most of them have a mental health team that try to connect you to resources as well. You do have clinics and federally qualified health centers like St. Hope, who does offer psychiatry and behavioral health at a very low cost, sliding fee scale. And overall, just any suicide line that's available is always a good source.
So I have a quick question. So would you recommend, if you think a friend or a family or a loved one, do you recommend that they call the hotline, the 988, if somebody is experiencing the crisis?
Absolutely. More people call the 988 or call crisis hotline than we think. And sometimes it be people we're close to. For a very short moment, I did actually do the crisis hotline, volunteer work on a crisis hotline, and regular people called all the time, and they'd be like, I just can't talk to my friends. I need to talk to somebody like right now. And so, believe it or not, people may not tell you, or they may not feel comfortable telling you, but they will call the crisis hotline.
And it is 2022. Is it only call-in now, or is there like a chat feature?
I think you can text. And then they have like a little chat feature on there too on the 988. I checked it out. They have a little chat feature where you can chat with the crisis intervention counselor, or you can call and speak with someone. I always encourage having a conversation and trying to call and talk, but we do live in a text message chat age where it's just less threatening to be able to chat without having any type of verbal contact. So that is available too. That's a beauty of the 988 number.
Nice. That's nice.
Yes, I love that. So it was great to have you. But before I let you go, which I really don't want to because you are so knowledgeable, do you have anything else that you would just like to touch on, or anything that you feel the people should absolutely know before you go? This is your platform to do it.
Before I go, I just want to take a minute. Can we have just one moment of silence for all the lives that actually have been lost to suicide? I just wanted to take that moment to think about all the people who have decided to make their own transitions due to whatever life stressors have come. Sometimes they have hit close to home, and people are left without answers, they're left without thoughts, or they don't understand, hey, what could I have done to make it better? Some people allude to suicide as selfish act. I, as a clinician, do not allude to it as a selfish act because we do not know all the time the entire story of what that person was experiencing in their mind or around them or what trauma was occurring. So I don't always think that it's a selfish act because sometimes it's what their best option is. It's just not what we believe the best option is. But it is also preventable, like you said. And I just want to make mental health constantly a part of the conversation. I want to encourage people, take care of yourself mentally. We have so many stresses going on in life, the way the world is now, the transitioning. We do live in a TikTok social media age, so a lot of things that we're digesting can be very depressing, can be very low and very dark, and we don't understand how many times that stuff filters into our brains, and then we are actually dealing with more stressors now because we've now digested what we see on different social media platforms. If you feel like you need to talk to somebody, if you feel like you need some help, don't hesitate to go get it. People are there for you. People are holding space for you. I'm so happy that I will say therapy in this age is such a dynamic topic. Charlamagne the God, I give him heads up. He says something about therapy at least 8 to 10 times on my commute to work about going to therapy and making it normal and making it a part of the conversation. And that's what we have to do. We have to constantly check in on people. Hey, how are you? I noticed that something wasn't right. Again, pay attention, be mindful, look for red flags and others that may warrant you to have to say, ask a direct question. If you find out someone went to the hospital or something of that nature, hey, are you all right? What's going on? So try to check in, try to be present, and don't ever take suicide as it's lightly or it's a joke or it's a lie or that it's not going to happen or that somebody is just using it as a mechanism. Again, I don't care how many times they say it, it's a cry out for help, and I never take it lightly. And I also want to thank you all for allowing me to be on this podcast today. Anytime I can come talk about anything mental health related, I consider it a blessing and a privilege because, again, it's something that we definitely deal with on a daily basis, and we have to start making it normal to get help, seek help, and utilize assistance.
Yes. So just to remind our listeners, you can actually call and book an appointment with Rolinda if you just loved her and the knowledge that she gave, or any of our other psychiatrists or therapists here at St. Hope. You can call 713-778-1300 or use the chat feature on our website, which is www.offeringhope.org. And we appreciate you for listening and
look forward to checking in with y'all on our next topic.
Thank you all and have a blessed day. And don't forget, at St. Hope, you are more than just a number.